I won't say I was surprised by the news. I was, I guess, saddened by the news and thought, well, we got to get him on the phone immediately. Chaz and AJ in the morning, 99.1 PLR, 95.9 The Fox. I was getting ready for the show yesterday, and I saw that Governor Lamont is self-quarantining after a member of his senior staff tested positive for COVID-19. So we have the governor on now. How are you feeling, sir?
Hey, Chaz. Look, I'm feeling fine.
Good.
And I'm getting tested a lot just to make sure that we're just erring on the side of caution. But I had some contact with Max Reese, our communications guy, and he tested positive, and that's when you take yourself off the battlefield for a little bit.
Right. So what kind of contact do you have with Max? Is that close proximity? Are you guys in an SUV driving to events together?
No, it was much more cursory than that. CDC says 15 minutes within 6 feet. We were not anywhere close to that. But, over the course of a couple of days, I see him intermittently. So let's be cautious. Right.
And he thinks, how does he think that he may have gotten it?
We're doing the track and trace right now, but he really doesn't know. So let me get back to you on that.
Yeah. It's tough, right? Because you never really know.
Yeah. It's the cold.
It's not like someone talks to you and they leave green spots on you.
That'd be a lot easier if they could.
Person.
Yeah.
Yeah.
Well, the good news for us is that with all the testing, and we're getting the results generally within 24 hours. So it's easier to track and trace than it was, say, back in May when we got the results in, say, a week. And by then you've hung out with 100 people.
Right. Now, do doctors have you on any kind of medication to, get in front of it?
Some of the legislators think I should be, but the doctors don't at this point.
Now, the legislators who think you should be, are those Republicans or Democrats?
A little bit of both, to tell you the truth.
Okay. Column A and column B.
So I'm guessing, most of us, when something like this happens, we just go into self-quarantine, get tested. But I'm guessing you probably saw your personal physician?
No, but I got tested.
Oh, excellent. Now, would you say, do you have any underlying conditions that your doctors would be concerned about?
No, thank God. I think I'm pretty healthy. I'm no spring chicken, but I'm feeling pretty good.
Good. And how did you find out, and where were you?
We did a event on Friday at the VA hospital in West Haven, where they'd had a fatality, and Max was there with us, as were a lot of the rest of the delegation. And I think it was that evening that I found out that Max had tested positive. So that's when we closed things down.
So he must have tested before Friday to have the results Friday night.
That's a very good question. We all test on Mondays and Thursdays. And we get our results within 24 hours.
Oh, on a regular basis.
Okay.
Wow.
All right, then. Okay, so he finds out, then does he call you? Is that an awkward call?
I think probably Paul Mounds did a quick search of anybody who had been in contact with Max. We're a pretty tight cohort in the governor's office, so we know who he's been in contact with and who he hasn't. Contact meaning, more regular. At the VA hospital, like I said, Susan and Dick and Chris Murphy, a lot of people were there, but they were in very passing contact.
Yeah, I saw a picture of you guys at that event, and a horrible event. An explosion kills a Navy veteran and a worker. 2 fatalities, 3 injured. But I saw you guys on stage, so it was Senator Blumenthal, Senator Murphy. And is your lieutenant governor also self-quarantining?
Yes. Yep, we're all going to err on the side of caution, which is what I urge everybody to do.
Now, do you guys all hang out together at the same place? Are you all quarantined?
Yeah, all live in the mansion, like a big sleep party.
Card games,
yeah,
right?
We're just hanging.
We'll play video games tomorrow, yes.
We're Zoom buddies.
Where does the governor quarantine? I'm guessing the governor's mansion?
Right now, I'm down in my house in Greenwich.
I would pick that too.
Yeah, good selection.
Yeah.
Just with immediate family, and we figured that was safer, at least till we get all the testing done.
Right. So now the governor, governor's mansion has a staff. You have security detail. You have family. Have you done a guesstimate in terms of how many people now from just Max testing positive are in self-quarantine?
If I had to guess, I would say it's probably 15 or 20. That's the cohort that probably is most, that's Paul Mounds and Josh Jabal and the folks that we get together in my office before we do the press briefing. We're all spread out and wearing masks, but it's still something you take a look at. In the governor's residence, I got a couple of security guys, some folks that help me out there, and they're quarantining as well.
The cat, yep.
What has to happen for you to be able to get back into full action?
For full action, it's a 14-day quarantine. In the meantime, I'm going to have multiple tests and just see, hopefully by the end of this week, what the status is.
Gotcha. And where are we heading with COVID now in Connecticut? I know Thanksgiving, you're asking folks to not have more than 10 folks over at the house.
Chaz, I think it's getting worse before it ggets better. We've seen our infection rate. I'm looking at New York, Rhode Island. I was on with all the governors yesterday, and we're worried about Thanksgiving. We've got thousands of kids flying back into our state, flying back into our region. Some are coming from like the University of South Dakota, where half the people could be infected. So we're going to announce today really strict testing protocols for people flying back into our state.
And then what about a major shutdown? Do you foresee that in the near future?
No, I don't. I'm looking at Europe, for example. They've kept their schools open, in particular K through 8. And they've done that in an environment which has had a much higher infection rate than we. And they've been able to do that quite safely. We leave it up to each of the local school districts, but I think we're finding that there'll be some differences this time compared to last time.
There's been some talk about rolling back to phase 1. Would you do that?
Again, phase 1, we closed the schools. I don't think that's going to have to happen.
Okay,
that works.
So it wouldn't be a phase 1.2 or phase 1 version 2. So school's not going to be closed.
Well, not at this point. I think retail can stay open, but we're hearing stories about crowding. You got Black Friday coming up, so we're going to have to be very strict on wearing the mask, and people are going to have to wait if they want to go in and shop. Same in grocery stores.
What is the violation?
Some of the common areas in malls.
Right.
Governor, what is the violation if you don't wear a mask in a store? I know they can ask you to leave or force you to leave, but is there a fine for that?
There can be a $100 fine.
Oh, okay.
It's really for those that are defiant. We've warned them a couple times, and they say, I'm going in the store and you can't make me. So the local municipal officials said, give us something to fine them with.
We're going to be talking to the Yale doctor heading up this. I believe he's on your COVID commission, too, Dr. Choi.
We got Dr. Albert Coe. I think you've got Dr. Coe probably. He's very good.
Oh, okay.
Head of epidemiology at Yale, and he helped our reopening committee. He was chairman of it.
Somebody called up and said that they have friends who work at Yale who say that people from New York are getting tested at Yale. Now, if a person from New York tests at Yale and it comes up positive, does that go into our positivity rate?
I think it's based upon address, but I got to tell you, Chaz, I'm not absolutely positive about that.
Yeah.
But it's a good point. That we have, New Yorkers coming into Greenwich, Stanford, Danbury Hospital right now just because we have some capacity and do a pretty good job.
Are we at are we at a point where we're worried about PPE for frontline workers again?
Less so. I'll tell you, compared to last time, we're much better off in terms of PPE. Obviously, we're doing 100 times more testing. We feel pretty confident about beds, a lot less use of our ICU beds in particular. But I'm worried about people. I'm worried about doctors and nurses. I'm worried about burnout and making sure we have enough people to take care of you.
What do you think about this COVID vaccine that Pfizer announced? Now, another company is saying that their vaccine is 95% effective.
Whoa.
Pfizer said 90% effective. When would you feel comfortable with folks in Connecticut, frontline workers, getting that vaccine?
I think I'd like to think it's going to be the first quarter of next year. It could even be January. We're working really hard to figure out how we get this distributed. It's complicated as heck. I mean, one, you have to store it at 100 degrees below zero, and then you have to have two shots, one 3 weeks apart from the other. You may find one vaccine is better for one population, another is better for a different demographic. So
Wow.
Deirdre Gifford is working hard to figure out how we can roll this out. And it's really good news, but I worry that it's going to make people relax and say happy days are here again.
Yeah, don't relax yet.
I thought the same.
Ain't out of the woods yet.
I
Yeah.
agree with you. I thought the same thing.
Right.
Will it be required for students and or frontline workers to get the vaccine?
I don't think so. But right now, Connecticut is more likely to have their kids voluntarily get the flu shot than any state in the country. So while there's a lot of crosstalk out there about anti-vaccination and the things, I think you're going to find the vast majority of people will get it. But look, let's face it, there's a little worry that people rush the vaccine out. So we're being very cautious. We got our whole vaccine board made up of leaders, scientific leaders across the state. We're saying we're going to only do this when it's absolutely safe and we know it's effective.
So you don't foresee Connecticut saying if you want to go to a Connecticut school, you need to take this vaccine?
Let's see if we have a problem. Right now, I'm hoping we're not going to have a problem. People are going to be smart enough to willingly take the vaccine. We're going to make it easy. We're going to make it free and make it widely available.
Gotcha. Mark from Woodbridge is on. He's asking about a party super spreader. I don't know if he knows of one, but I guess the question is, party super spreader, close the high school. What about a fine for hosting these events?
There is a fine for hosting those events. But the inverse of that is we also want to be able to call the person who organized it and say, give us everybody that was there so we can notify them on a track and trace. And a lot of the folks who host these parties are very reluctant to do that, don't want to get the kids in trouble. And you're going to get them in serious health trouble unless you give us that information.
So rather than fine them, you're asking them to cooperate. And then if they don't cooperate, do you fine them?
I would.
I wouldn't go that far, but I think you can see the balance we got as we reach out to these people.
Right. So you're leaving that, you're not dictating from Hartford how this stuff works. You're letting the local officials figure it out.
Yeah, they're the ones, as I said, they wanted the fine in the first place. When it came to that restaurant that turned into a bar, they said, hey, the only choice we have is to shut it down or give them a firm warning. So the fines were one way that they can have it intermediate, but if it happens again, we're shutting it down.
All right, excellent. Governor, anything else we should know? Any other announcements coming today?
I don't think so. I think that, look, I understand how incredibly exhausted we are. We thought we had rounded the bend, and here we go again. And it is different this time. We're going to be much more specific in our response, try and do everything we can to allow you to live your life, but to do it safely. And my real focus is on those K-8 kids. I just don't want them isolated at home. So we're trying our best to keep them in school if they can.
And a lot of these school systems are closing down and doing remote learning, and they're doing it on a case-by-case basis. So, well, Governor, thanks for coming on. Glad you're feeling okay. Tell Max we were asking about him.
Yep.
All right. Thanks, Chaz. Thanks, AJ. Appreciate you
Governor
guys.
Lamont, thank you.
Chaz and AJ in the morning.